everyone, and welcome to today's SOAR webinar on innovative ways to utilize consumer peer-run organizations in your SOAR process. Today's webinar is presented by the SAMHSA SOAR Technical Assistance Center at Policy Research Associates under contract to the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services. My name is Pam Hine, a SOAR Project Associate with the SOAR TA Center, and I'll be moderating today's event. Before we officially begin the webinar, I am honored to introduce Dr. Pamela Fitter, Social Science Analyst with SAMHSA SOAR Center for the Mental Health Services for the Homeless Services, who will give our welcome this afternoon.
Thanks, Pamela. There seems to be a lot of us with that name these days. Good afternoon, everyone. As we said, I'm Pamela Fisher, and it's my privilege to be the SAMHSA Project Officer for the SOAR program. Kristen Lupfer and the SOAR team over the years has been a great pleasure and inspired every day by the good work all of you do. I want to welcome everyone to today's webinar on innovative ways to utilize consumer and peer-run organizations in SOAR. Those who have participated in the SOAR webinars before know how informative these presentations are, and I hope you are particularly excited about today's topic as I am. Although consumer and peer-run organizations operate in most communities across the country and are recognized as providing excellent services to people with behavioral health issues, these organizations are often overlooked assets in our service systems. We gained an excellent panel of presenters today who will be discussing various aspects of consumer and peer-run organizations can increase the reach of SOAR programs. So I'll turn the webinar back over to Pam to introduce our speakers and get started on this important topic. I also want to thank everyone again for joining us today. Thank you. Pam?
Pamela, we appreciate your welcome and your continued support of our webinar series. So just a few housekeeping items before we begin. This webinar is being recorded and will be available for download on the SOAR website in about a week. Your lines will be muted throughout the webinar. Now you may download the PowerPoint slides. If you look to the top of your screen, you will see a file icon. You can save the document and download the materials that way. We will also make these materials available to you on our SOAR website after the webinar. At the conclusion of the webinar, you will be directed to a link for an online evaluation. We value and appreciate your feedback and use it to improve and inform future SOAR webinars and activities. So we ask that you take a moment to complete it immediately following the webinar. The agenda for today's webinar. On today's webinar, we have our own Matt Knutson, Project Associate here, who is leading the SOAR TA Center's efforts on peer support integration into SOAR programs nationally. He will provide an overview of peer services and share strategies for implementation. We're also very pleased to have several program managers and supervisors who have taken an active role in all aspects of integrating peer support into their state and agency SOAR process. SOAR State Lead for Vermont and State PATH Contact with the Department of Mental Health will begin our presentation. And Joshua Black from Olympia, Washington, followed by Kara Coleman from Allegan, Michigan, and Bill Dowd from Flint, Michigan. We have our panel 3 certified peer support specialists, all from the state of Michigan, to share their experiences and also their recommendations. We have John Mills, Ben Busfield, and Joanne McCann, all from Michigan. Before we begin, we would gauge your level of peer support integration into your current SOAR program or local initiative. Let me just pull up the poll question here. So we are asking the question, To what extent are peers involved in your SOAR process? You will see a multiple choice response. So pick the one that best describes your current involvement and maybe some future plans for SOAR. Your agency or program currently uses peers as a part of your SOAR process. B, our agency currently uses peers but not as part of our SOAR process. C, the third, our program does not currently use peers but would like to hire or partner with a program that has peers, inviting them to participate in SOAR in our community. And lastly, D, we are not in a place currently where we are considering hiring peers but would like more information about how to make that possible. Take a moment and record responses. Okay, so let's share the results of that poll. And thank you so much for taking the time out. So we see that maybe a third of you, interested in definitely having some more information. It's nice to see about a quarter of you do have some peer involvement in your SOAR program, so that's very encouraging. So you're at the right place. We will be sharing some great experiences with utilizing peers, but also sharing some recommendations and implementation ideas for you. So thank you very much. Okay, so now I would like to hand the mic over to Matt Knudsen, who will begin his presentation. Matt?
Yeah, just starting my camera.
Okay.
My name is Matt Knudsen. I'm a project associate as at the Technical Assistance Center. We're excited to be presenting today's webinar. I remember to tell everyone before I start a presentation that I'm a person in recovery from substance abuse and mental health issues. We were from youth in transition. I made the transition in my teens and early 20s. Unfortunately, it was a transition to dropping out of high school on psychiatric hospitalization and homelessness. Love arrived, and I now have a great life, a family of my own, a great job, friends, hobbies, and purpose. This is because I was able to access public benefits, treatment services, and most of all, peers who showed me that recovery was going to be possible, and there was hope that I was going to be able to get better, and in turn, my life was going to be able to get better. Early I didn't trust people. Like many of us, the settings and the lifestyle that I lived in was where you didn't trust people. Because of this, I was what's hard to engage. I look at people sometimes who were actually trying to help me as people that were trying to hurt me, that were going to lie to me or let me down. And it was not until that I met people who spoke my language, my peers, people that had been down the same road that I had been down, that I finally felt safe to take risks that ultimately started my recovery journey. And how we can implement these vital services into the programs that you operate. Peer services are provided by people in recovery from mental health and/or substance use disorders. In helping those we're serving, a big part of it, the benefit is that it actually helps those who are providing the support. Modeling and promoting recovery and hope, teach skills, supporting empowerment, and helping people navigate the complex system. Peers are providing their expertise and supports in a number of different settings. We're in outpatient settings like clinics and bridger programs. I'm going to talk about one of those in a little bit. Supporting people's transitions out of jails and hospitals, and crisis residents, helping people stabilize, on street outreach teams, and as you will hear more about in a bit, and SOAR programs. But further, I think it's important to mention where we currently are in the road that peer services have made towards being fully accepted and respected by policymakers in the service system. engine that could of service options. Sort of the slightly bigger engine that we should be using more of, and the value is established. In 2007, the Center for Medicare and Medicaid Services, in its letter to states, indicated that peer support services are an evidence-based mental health model of care, and they recognize peer support as an important component in every state's delivery of effective treatment. Additionally, SAMHSA identifies peer support and consumer-operated services as evidence-based practices. The institute emphasized the importance of peer support and peer-delivered services in its landmark report, Improved Quality of Mental Health Care and Substance Use Conditions, the Quality Chasm Series. Support works. Peer effective in engaging people who are earlier in their recovery and who may be hesitant to use traditional services. There's an automatic sense of trust that you get when you're speaking with someone who has been down the same path that you've been down. Research suggests that the deployment of peer staff may be even the most critical in the early phases of engaging people in a care, including people with substance use disorders and people that have criminal justice histories. These are especially useful when working with special populations such as veterans and young adults. Peers are able to show people that recovery is real and possible. The important word here is show as opposed to tell. I think we can all agree if we wanted to know what a foreign country was like, we turned towards someone who had been there as opposed to someone who watched the Travel Channel a lot. It's important to mention that before I got in recovery, I had actually never met a person that had mental health and substance use issues and who had gotten better. I knew people that were living and hanging out with me, and then I knew people that didn't seem like they had those issues, but I'd never met anybody who I personally knew that had recovered. An important thing to mention is that recovery of the peer providers is also strengthened. There's no better feeling in the world than being able to have purpose, to have your self-esteem and confidence boosted on a daily basis because you're helping your brothers and sisters in the struggle. Provide a non-clinical view about a person's strengths and challenges, and we bring a lot of extra passion sometimes to organizations, which is very important. We also have our hand on the pulse of the local culture. Examples of what's out there. You could also contact us and we could give you additional outcome examples. In 2006, the Georgia Department of Behavioral Health and Developmental Disabilities compared consumers using certain peer specialists versus consumers who received only traditional services. Consumers using the services of certified peer specialists showed improvement as compared to the control group, showed a reduction of current symptoms, behaviors, increase in skills and abilities, and very important, the ability to access resources and meet their own needs. In cost of services, those using certified peer specialists cost the state on average only $997 versus average cost of $6,500 in day treatment. The average savings was $5,494 per day per person. The Bridger program was evaluated, and the researchers found that while in the program, people had significantly lower hospitalization rates. During the 2-year baseline period, matches were hospitalized at an average of 60% of the time. While enrolled in the program, they were rehospitalized only 19% of the time. That was an improvement of 41%. Strategies for implementation, I think that people appreciate the slide here and the visual, because I think that in any project that we're on, in any project that we've worked at, or program that we started years ago, and we're now at a place where we can say that we're successful, we can look back and we can say that this is pretty much, one on the right is actually what really happened as opposed to what our original idea was on how we were going to get from point A to point B. That we do is to find your champion to address issues that arise on a systemic level and to keep the development of peer services a priority for your agency. Prepare a clear job description that's fully endorsed by key stakeholders. We actually have copies of the job of some of the folks that will be talking in a moment, and we're going to be able to share them at the webinar. It should be relevant competencies and a clear policy for evaluating job performance. We have to make sure that involve everyone from the start and make sure that the peers that we work with reflect the cultural, linguistic, and social diversity of consumers that you serve in your community. Contributions that peers make. The optimal benefits of hiring peers will not be realized if they're only trained and expected to carry out traditional case management tasks. That's extremely important. This is tricky is in a place that lends itself to help and technical assistance. Also, it's a good place to start with at least 2 peer staff that work for your organization if it's your first entry into using peers. This gives people an opportunity to share job experiences and provide support to each other. Connect them with other sources of professional support specifically designed for peer workers. For peer staff that covers the specific skills and tasks required in their roles, using their recovery story to the benefit of the people they work with, listening effectively, creative positive relationships, addressing emergent situations, fulfill document requirements, adhering to ethics and confidentiality rules, setting boundaries, and resolving conflicts in the workplace. Provide supervision for peer staff that concentrates on skills, performance, support, rather than somebody's clinical status. This is the expectations of peer staff that are equivalent to the agency's expectations for other employees. This is very important and something that I've seen done wrong before, and it had consequences and some challenges for the organization. Work, the peer staff are not the only ones that need training. Provide training and education for non-peer staff as well. This should cover the ADA and its implications for hiring, reasonable expectations of peer staff, ethics, boundaries, adopting person-first language, and a respectful attitude towards all coworkers. Benefit specialists who are knowledgeable about the various work incentive programs and ways employment may affect a person's benefits are also available. And lastly, something that's always important, it's very important to show success stories and share them with the community broadly. Now here to turn to, and people can contact me, I believe, well, there's my contact information right there. Website, the organization, Intentional Peer Support, the National Association of Peer Supporters, your Office of Consumer Affairs, which most states have. It might be called something a little bit different, and statewide consumer networks. Most states have statewide organizations that are advocacy organizations and training and information sharing organizations that are made up of and run by peers. And you can contact me if you would like more information. And now I turn it over to the real experts, the ones who are actually using peers in their programs now.
Much, Matt. And we do hope that you reach out to Matt. He's very accessible and would love to hear your ideas and help connect you to connect your peer support to the SOAR program. So again, thanks so much. Now we hand over to Brian Smith, who is a SOAR state lead of Vermont and also the state path contact. Brian?
Involve people in intentional peer support. I confess to having landed in the state of Vermont about 2 decades ago for work, and Vermont is already predisposed to using peers in provision of mental health services that long ago. Not necessarily for SOAR, but did have a various organization to me called Psychiatric Survivors. The Department of Mental Health actually funded VPS as a for-profit that provided support, education, and advocacy to anyone statewide, whether they were getting mental health services from our designated agencies or not. They were this grassroots organization. they actually funded one of their publications called Counterpoint, and I always thought it was curious that the department funded a newspaper that usually was railing against them and wanting change and use that in many ways at the legislature. So this was my first sort of learning experience about involvement in mental health services 20 years ago. Vermont has had additional peer support programs independent of the community mental health center system and with it in a lot of cases recently. And I'll create a list of these. You can do VPS Vermont or the next one, Alyssum, and learn about a home where someone who has crisis for respite can go in a country setting and with only a few bedrooms and have whole food, home cooked, and a variety of sort of supportive services outside of the traditional mental health system of care, all provided by peers. And it has had remarkable success. Recently, and actually opened this spring, was a model called Soteria House, a residence for people who had their first break in psychosis that were going to acute care in a hospital or at a community mental health center or anywhere else. They were going and are going to that was developed by the Department of Mental Health that is entirely peer-run through some organization you may know, Pathways. This is Pathways to Housing Vermont. So it's all staffed by non-professionals who approach their work relationship with residents as people rather than patients. They're focused on being well rather than suing to a patient. And they are not always recommending antipsychotic medications, which is something that a lot of peers are very glad about. So, and I'll give the listing of these dramatic pieces in utilization of peers outside of SOAR that informed me of what steps to take to have a good work model. Here, the last that I reference is Wellness Co-op, token by peers. It's a peer-run community center, and things that it covers is the Hearing Voices support circle, regular peer support circle, a writer circle, a laughter yoga, employment seekers support circle, all run by individuals who are receiving services in the mental health system care. So, Vermont last states to adopt SOAR. I don't know that we should be proud of that. We had a similar model by another state agency that thought knew what they were doing very well, and finally, with prodding, cajoling, and support from Pam and others, break years, and several years ago began to train up folks to become. Most of wanting to do this was to do it for people who go to the traditional systems of care, and to do that, I wanted to do it with our PATH providers. The PATH providers projects assist people in getting out of homelessness, not community mental health centers. They have always been they're community not-for-profits, some peer-run, certainly all who employ peers, and of the community mental health system of care. We did that, actually done before I arrived, to ensure that people don't feel like they're going to the place they don't want to go to. And it's been very successful. So, in working with introducing SOAR, I began to work with path providers and peers of path providers, and in particular, Pathways to Housing Vermont. Pathways to Housing espouses the Housing First model. It meets people where they are. It doesn't make them jump through fiery hoops to get or maintain their housing, and has an 85% success rate, and as sort of acknowledged by HUD, is overturning the model of transitional housing wide and in McKinney-Vento funding. We began small, and we have managed to engage all of the path providers in the train-the-trainer model, and they are well received by the people they're working with. We have more in Rutland, Vermont, I think, who's been other calls, and I'm happy to introduce you to some of them if you find this interesting, and to share some of the websites of the issues and programs I've described. It is a no-brainer. I think when it comes to have a communication or communion with someone who knows your experiences and can share that back with you, you have a busy engage them more in accomplishing things on their own. It's the sterile model, and don't quote me, of traditional mental health systems of care. So I highly endorse it, and if you're among those agencies that don't, I would feel a little bit more about it, and then, as you were suggested to, who would be a champion, and see how you can make this work in a demo model or with a particular segment of your system of care. Happy to take questions later or share those websites.
Thank you so much. Folks learn a lot from you as the SOAR state lead, and using peers from the very start of your SOAR program, from train the trainer to developing local leads who are peers. So we really do appreciate that, and look forward to individuals reaching out to you too. So with that, we're going to listen to Joshua from Washington State. Joshua, it's all yours now.
Great, thank you. And I want to thank you, Pam, for actually reaching out to me and giving me the opportunity to present in this webinar. I really do appreciate that. My name is Joshua Black, and I am the program manager for the PATH program at Capital Recovery Center here in Olympia, Washington. I've also completed the certified peer training here in Washington State, and I went through the stepping stones to recovery training for SOAR about a year ago. Slides right now. A little bit of information on Capital Recovery Center where I work. So Capital Recovery Center is located in Olympia, Washington, and Recovery Center serves Thurston and Mason counties in Washington State. A consumer or peer-run licensed community mental health agency and a 501c3 nonprofit organization. Capital Recovery actually began providing services in 1988 at Capital Clubhouse, and that was prior to Washington State defunding the Clubhouse model of services. Capital Recovery consists of three very distinct programs, but three that work very well together and complement each other very well. Our largest program is our peer support program, and that provides advocacy and case management, both in group settings as well as in one-on-one settings. We have a program, the program that I manage, and those who don't know, that stands for Projects for Assistance in Transition from Homelessness, And we provide outreach and case management to single adults who are experiencing homelessness or are at imminent risk of homelessness, who are also experiencing serious mental illness, and who may also be experiencing co-occurring substance use challenges. Our recent program we added about 3 years ago is our Limpiar Downtown Ambassador Program, and that consists actually of 2 different teams. We have an ambassador team, which provides customer service and social service referrals to visitors and all the residents of downtown Limpiar. And then we have our clean team and kind of suggest focus on trash removal and graffiti cover-up and removal and other beautification projects in downtown Limpiar. And the goal of the Ambassador Program is to make downtown Limpiar a welcoming, friendly, clean environment for everybody. I mentioned that all programs at Capital Recovery Center include certified peer counselors. I also want to make the distinction, because you'll hear me reference certified peer counselors and also peer support specialists. Our center is not licensed to provide counseling. We're not licensed to provide therapy. We provide peer support. So the individuals who we have who go through the certified peer counselor training get hired on as peer support specialists. We also have individuals like myself in the PATH program and also in the Downtown Ambassador Program who have gone through the training but working in the role of peer support specialists. So I'll refer to us as certified peer counselors. And state our certified peer counselor training is a very intensive 40-hour training, and that's a written exam and an oral exam that individuals have to pass with a score of at least 85% or more. Now I'll do peer support and SOAR as it relates to Capital Recovery Center. So our peer specialists, they can assist throughout the entire application process. Many times that process will begin with our PATH program in the community, because it's that first point of contact for individuals, and they can really start the assessment process there and really start to spark that hope and build trust with individuals. And peer specialists with SOAR are effective because they can provide a level of empathy that's forged through their own lived experiences. They're judgmental advocates for the applicant, and they can build trust from the start. And I think the non-judgmental part of that is very important, because the application process itself is a judgment. So to have an individual there who's not judging you and is really advocating for you, we found to be very effective. Our peer support specialists don't provide just assistance with the application, but really the key is to provide that emotional support through the process. Part of it comes with really creating a welcoming and comfortable environment on site. We really pride ourselves on that, but we're also able to meet at other locations more comfortable for the applicant. Support specialists, they work with disability determination service representatives and social service administration representatives. They can do that on behalf of the applicant, or again, going back to that emotional support, can just be present during the conversations. We at Capital Recovery Center have found that the most effective model in which to utilize SOAR and peer supports together is to identify just a couple of peer support specialists who are our benefit specialists, individuals who do most of the nuts and bolts of the application process and really be more the true representative for the applicant. The other support specialists, they can provide more of that emotional support that I had mentioned previously. Another thing that we try to do at Capital Recovery Center is have people on site, not necessarily paid staff, but we can utilize interns and volunteers who successfully used this to offer SI and SSDI benefits themselves. Giving people access to individuals who have personally and successfully gone through the process can give hope to new applicants and really lower anxiety levels. We found it to be effective, but we've also experienced challenges, like I'm sure a lot of you who are implementing peer supports and have. turnover has really led to us having fewer and fewer SOAR and trained individuals at Capital Recovery Center. Levels of staff turnover are a pretty common theme with nonprofit organizations, and we're certainly no exception. And have fewer SOAR-trained individuals to help, that really decreases your capacity to serve, like as in our case, and puts increased demand on those who actually are SOAR-trained. We've had periods of time where I've been the only SOAR-trained individual at Capital Recovery Center. In the PATH program, I can speak from experience that can be very, very overwhelming. In response to that, we're really trying to pursue funding so we can increase the number of SOAR-trained peer support specialists we have available. And we're trying to add more support in all three programs. We find it very important to have them in all three programs. We've only had SOAR-trained individuals in the peer program and in our PATH program, but we find it important to have it in our Downtown Ambassador program because they're providing outreach and social service referrals 7 days a week. They're doing so in an community with the most density and need. We expect our ambassadors, or really the PATH staff, to be through much of the nuts and bolts of the application process, but being able to be that first point of contact out in the community and really understanding the process and giving hope from the start and interest and getting them back here to meet with our benefits specialists, that's really the ideal model for us. By saying that peer SOAR together work, that's been proven, and we've found that to be very true and very effective. It's very important to let people know from the start that it takes time and it takes commitment from everybody. Very, very important to be upfront and honest with applicants from the very beginning. Really build trust and get that commitment from the start. If an applicant's not committed or prepared from the start, they can become overwhelmed, and I've personally seen people give up, and that's unfortunate. And it's not only demoralizing for the applicant, it can also be very demoralizing for the peer support specialist. Works. We just need to spark that hope and give that hope to the individuals from the start. And I'm going to put my contact information up here. I believe that there's going to be questions and answers at the end of the webinar. If for whatever reason we don't have time for me to answer questions, or if a question comes up after the webinar, but you'd just like to talk, give me a call or send. I'm more than happy to talk to anybody.
Thank you, Joshua. And, getting the message out there that, peer support specialists can really help with capacity building, especially in this time of, staff turnover, doing more with less resources. So thanks again. Now, the rest of the webinar, we will be hearing from our folks from Michigan to highlight the good work that they're doing. So our next presenter is Kara Coleman from Allegan, Michigan. Kara, the floor is yours.
Just want to welcome everyone to the webinar again, and I'm really excited to be a part of this webinar and talking about what we've done here in Allegan County in Michigan with our peers here. To house back in 2010. It was pretty much a one-person show here, and in October 2010, we started with the SAMHSA research grant. We were able to work with some regional partners to get funding through this research grant to employ evidence-based practices, one of those being supported living. So I was excited about that and was given the reins shortly after I started as a supervisor to supervise the peers, which was really exciting for me. So let's kind of take off with these programs and do that would be effective for our community in providing not only peer services, but outreach and SOAR and housing services all kind of packaged in one deal. So originally we started with our peers through the research grant. During the time we had our peers within the first year become certified, so that was awesome, which then we were able to leverage some Medicaid funding to also support their salaries and services. have 2 part-time peers in our housing programs. One is full-time PATH program, and one is split between PATH, mental treatment court, and supportive housing shelter programs. So a lot of the peer training we have here in the state of Michigan is offered through our peer network, community mental health services, which has been really awesome. So they've had certification, they've had training through the SOAR specifically to do SOAR interviewing, which is crucial in helping people kind of realize how they need the access to community mental health services. Trauma-informed services I thought is also really important. And then Housing First, we're definitely a Housing First program here, providing, people housing even before they have, the community mental health services or substance use services or whatever in place. So we definitely use that model here. You don't have to be sober to enter housing. You don't have to have, employ anything else in place first. It's housing first, and then we work on all those things, put those in place, along with SOAR being a big part of that. Our peers here assist our claimants through the entire process of the SOAR application process. Again, here we have a very specific process we follow. Both our peers have been trained in that process, and they began with our SOAR consent form, which sets the filing date on the representative. They with Social Security and the disability determination as well through that whole process from initial application to approval. Had our peers assist in appeals so actually representing the claimant at a hearing, positive, and we incorporate a team approach here. So as a advisor, I really have an open door policy with my peers, and to any questions they have during the SOAR process, or if they're doing street outreach, I just have an open door policy. They can come in and talk whatever's going on, if they need specific referral, not sure where to go or how to access different providing area, I give feedback as well. And then through the whole SOAR process, especially as it relates to the medical summary, those. And then in addition, we send it to Policy Research Associates for another step of review before we actually turn in our SOAR application. So I feel like the supervision is the key part of employing peers in the SOAR process in your programs. So far from data, we've done 3 initial applications. We've had 2 approvals and 1 denial. We took to an appeal, and we were able to win that so that was exciting. And organization to remember that a supervision is vital for support, providing effective support to peers. Understanding not only that they're providing case management equivalent services in many cases, but have their own recovery journey they're on. So I think the open door policy is really crucial to that, and I found it to be beneficial, and I've learned a lot from my peers as well as they've learned a lot from me as well. I think for a supervisor, being sensitive to the peers' own recovery and not making assumptions about where they're at, but asking is really important as well. And it's just routine check-ins. How are you doing today? How are things going? Especially if you know the caseload that has people that are trimorbidity with, chronic homelessness can spark some, stuff of their own trauma history. So weekly check-ins are important. Here we have a weekly meeting every Monday. Decide 2 hours. That's really to review caseloads, but also that check-in and just seeing where they're at themselves. The other thing I've encountered is our peer salary to be low, which in one case is fine, but then I think the disparity between those 2 salary ranges to me are too far apart, given peers here at Allegan are doing a lot of case management activities that are very similar to what our bachelor's level case managers are doing. The other thing is finding grants to cover the peer case management can be a challenge as well. We were lucky enough to have a SAMHSA research grant, which ends this September, and we also utilize our PATH grant for peer services in our housing programs and outreach. But then for supports other than Medicaid have services within your organization is important. The other thing is I just want to say that it's important to be intentional with how you will use peers in your organization, especially in the SOAR process, and your program not to only support those experiencing homelessness, but also to support your peers. So, and here's my contact information at Allegan Community Mental Health if you have further questions or comments as well.
Thanks so much for a great description of your program. Now we move to your colleague, Ben Busfield, who will talk about his experience as a certified peer support specialist and how he implements SOAR that he serves. Ben, it's all.
My first impression of SOAR was interesting. I was very hesitant at first. I'll be honest, I did not like it because I felt I was too invasive in the person's life, digging through all of their actual personal hospitals, hospitalizations, mental health, etc. With having a wonderful supervisor and being able to talk and bounce that off of, I did give her it, but doing the MSR and gathering the information was fun. The other I really enjoyed because I do like writing, and coming from a non-clinical background, I to work with Bill, that's also on the conference a little bit for questions and stuff. Von Perret, and they all came back with, it was nice not seeing the, so to speak, $50 words. It was bringing a person to life was really nice. Working, my very first one was kind of because you gauge by packet that, you know, you have so many questions and then you to some other questions, you gauge by their it was getting uncomfortable for them, and you can choose which ones you wanted to come to, and for that individual. A peer hearing was interesting. Never having to go into court in my life. I would recommend wearing a tie. It was one thing I did not do and was called on the carpet for, but an interesting processing how the test questions and what he was looking for. Claimant's responding, he had called me, and the only thing he could say was, "When," and he started crying, and he hung up the phone. And then I lost it, and what's going on? He calls me back shortly later, and he says, I don't know what you did, how you pulled off, but I won my case. I'm getting my check in a few weeks. And that was a wonderful feeling. What it means to me to do this with my, I have a long period of time of being homeless, but when I'm homeless, I was always told, you know, there's nothing, there's you know, you can either go to shelter or couch surf. I was running into a lot of closed doors, and all I had was a food stamps or a food benefit card, and being able to somebody give them that hope of, you know, kind of sustainable income a little while until you decide, you want to go back to work and pick up that slack of what you're getting for disability is just awesome. And being able to actually be with the individual when they and get the keys dropped into their apartment, probably sometimes years, is just very to actually get somebody housed. And supervision, accessibility to a supervisor is, I'm fortunate. John and I both are, to have a wonderful supervisor that will take time. If you're out in the field, you can call in and say, I have a client that's in meltdown mode, and I'm not dealing well with it because it's really dredging up issues for me to be able to in your tracks and give you snow that you sometimes overlook. It's great. Helpful hits for employing peers. I think have a real good team approach. That I would really like to change is some of the stigma that's behind peers, because I'm knocking individuals or counselors, but some of them have been in business for quite some time and are not accepting to the newer set of, and it's difficult for them, it's difficult for us, and it's slowly changing. Would be some of the biggest roadblocks or challenges I feel that are out there. Employment, your funding, the funding for the peers would be really nice to see a higher pay wage. Ideas for grants or maybe a grant or something that you guys are doing, have heard of, would be one to where, we're very rural. There's two of us right now, two peers in the county. Unlike some counties in Michigan where they have an abundant amount of peers. And further, and get some more staffing would be really nice. And just if you're gonna really love the peers, I suggest having a very good supervisor that is very open to, somebody with a mental and different challenges. It's really worth the world through it. To John, and then my contact information. You can email me is actually the best. I'll give it to John.
Hi, everyone. I'd like to thank Pam and everyone else for making this webinar happen today. This is really pretty cool, and it's actually my first one that I'm able to speak at. Before I get started with the slides, I just want to say I was diagnosed with a mental illness a few years ago, but it's been an endurance trauma since I was little. I'm older, 52, but not that much older, and I just wanted to say that it was probably the best thing that's ever happened to me in my life to be able to be a part of this group I'm with. I've done other things in my life. As a young man, I was a veteran, so being that point right there, I get to work with veterans now in the future. Because there's a lot of them in this area through the Battle Creek VA and the Grand Rapids VA, and there's a homelessness issue there with them as well. So I'm going to be honored to be working with these people who have served the country so well. So Being said, as for my first claimant, so I'm only claimant, even though I'm a representative for a handful of others that I'm getting started with. I'm working with an individual since last year, and my first impression with SOAR was, here's an avenue of an approach that seems to help the Social Security Administration open their eyes that claimants aren't alone anymore. They've in the past where they've tried to apply for Social Security, they get frustrated, the process is difficult, and it puts them under duress, and now they have an approach where they can have some help through peers even to get things going for them. And with the SOAR on the paperwork, it really helps because I think it awakens them to say, look, these guys are serious, and I'm serious about this. Like I said, first impression was here it is, and it looks good. So getting medical evidence and reviewing to me is like detective work. Like Ben said, it does seem a bit invasive, but what I'm thinking is it needs to be done to find, because maybe I might be able to see something that SSA doesn't see. So review evidence for me is a lot of fun. I mean, I'm a detective doing that kind of work, and it's rewarding so far with helping this particular individual to where I could write an accurate MSR. And when I had my first hearing, it was yesterday, so I'm really new at the game, and the judge commented and said my MSR was very thorough, and he appreciated it very much, so that helped me because, you know, self-esteem issue I've been working on all my life, so that was really quite helpful. I've this place, and apparently if you Google it hasn't been built until a few years ago down in Valparaiso, Indiana. If you Google it now, I think that it's from 2009, and it's not there. But when you walk in, they have security there for you to make sure your phones are off or non-existent. But the thing was, they hand me a disc of everything that they had on my claimant up to that point, and allow you to go to a room and consult with your claimant, make sure that all your records are up to date. And I was unaware of that at the time, but I found out it was very helpful in the future. So I recommend that anybody that has to go to a hearing, well, at least there, maybe go an hour or so ahead of time so they can look over that disc, and it is very helpful. Right now, we're awaiting a decision. We yesterday, but we weren't denied, so that's a good thing for the client. Provided enough information for the judge, but still, he's a very thorough judge. He was a good judge and very honorable, so I should have hit him of dismissing the case right away. But there's more information that he wants to go on his end, and so we'll be waiting for that. And the claimant was very appreciative of just me being there with him. Quite nervous heading into the hearing, but he had read a bit, and he felt pretty good about it. And frankly, he did a good job, and I was very happy for him. So I guess my response for using SOAR was you need to find some time and work it into a busy schedule. You know, if you can show one day, maybe even 2 days a week, if you're doing like myself, I'm doing outreach, so I'm pretty busy, but I'm supposed to be sending some time off for get stuff together, which is very helpful. Like Friday for me works best, where I concentrate on nothing but SOAR. So moving to me being a peer, I had no idea up in a year and a month ago, and how long I've been with this agency, I didn't even know there was peers out there. Had I known that somehow, I'm connected with them because it is a trust issue. speak to a clinician, I feel guarded. I do not want to give up certain information for the result of being persecuted or judged. So, like I said, if I'd have known about peers, I'd have been all over that, because I tell you now that I've met people, and it's usually part of my disclaimer. I tell them right away that I'm not a clinician, but I'm not a psychiatrist or psychologist, and I'm a certified peer. And then how I became a peer was to have received services out here myself at the clinic, also to have struggled with homelessness in the past. And the trust issue is there. They just really warm up to me. I've actually had some people comment, I'm like, well, this is I can do. They just seem to really warm up to it. That helps me out, because part of self-esteem is not being trusted. And when they say they trust me, that's a great thing. It just helps me move forward. And it's one of the greatest challenges. Like I say, I was a former Marine, and that was challenging enough at the age of 18. But now at this age, you figure, it's time to start rolling back a little. But I'm actually increasing my education even further. I have a wonderful supervisor who pushes me, and as a Marine, they all know you got to be pushed sometimes, and she's great at that. Probably just the most wonderful thing I've ever done in my life. I am really rewarded by the people I work with. Supervision needs to appear. The accessibility, and I'll tell you what, like Ben said, our advisor's great. We're not just sitting because she's sitting right next to us. She's thoroughly involved on our feelings as peers and our needs as people do need. She set time aside, but we come around and ask her questions anytime. And to me, that's extremely helpful, because I have questions all the time. Being open to peer input and support, that's a positive, because I always have ideas. I'm an idea guy. And so when I both have ideas, we've been doing a lot lately this past year, and I've seen things that I said a year ago. So that just proves that she's listening, and she understands and appreciates the input. Help for employing peers. For the trust issue, because we've lived the experience. I wasn't just homeless one time in my life. I was homeless a few times. First time, well, it wasn't fortunate. It was unfortunate. My house burned down due to bad wiring, and there I was, homeless again, living out of my Jeep, and I was housed through our housing program, and now I just seem to be good fit in the organization here, because I know how it feels to have a home. And if I would change, I'm going to just personalize that as my organizational skills, because I'm really totally organized yet, but I'm working on it. And moving forward, people with mental illnesses, I really personalize that, because I have a mental illness, and it took me a long time to really, because I don't want to have a mental illness, but the real world I live in, and I communicate better to people that have these issues, that understand, and so it's a very rewarding. I'm stressed.
Thank you so much for that wonderful, wonderful presentation. And congratulations on your first hearing. It sounded like a great experience.
It was a lot of fun.
Yeah, I'm glad you look at it that way. our next webinar is on hearing tips for readers next month, so we will have more on that topic. So we are going to move on to William Dowd, also known as Bill, who's been a great mentor to everyone in Michigan. And I wish we had more time, but Bill will do a pretty brief presentation so that we have time to hear his colleague Joanne's story. So Bill, I'm going to pass it on to you. Bill, yes, we're good to go, Bill.
Great. Greetings to everybody. Muy buenas tardes. And also want to say this is Thunder and Lightning. I'm Thunder, Joanne's Lightning. What we're going to do is tie in very quickly. As a manager, it's my job to bring in PATH outreach, as we are a PATH program, peer support services, the supportive housing toolkit as one of the best practices, integrating best practices, and last of all, Medicaid billable activity, because you're going to pay for your program is learn how to access Medicaid for your clients. This makes a big difference. Genesee Health System Community Housing, Genesee County, the city of Flint, same as the continuum of targeting adults with severe and persistent mental illness and or co-occurring substance use or dependence disorders. Provides outreach services, consumer engagement, connecting prospective tenants to housing benefits and community-based services. Provides targeted supports for housing retention and assists consumers with acquiring skills, income, education, and applying for benefits. An important adjunct to this process is the utilization of certified peer support specialists to connect consumers with assistance and supports, including making the application process for housing and benefits both accessible and understandable. Support and SOAR, Certified Peer Support Specialist, is assigned full-time to community housing. CPSS staff are trained agency-wide and credentialed with the state of Michigan. Peer are cross-trained recovery coaches, familiar with substance use and motivational interviewing. Staff provides peer support to consumers throughout all aspects of the housing assistance process, beginning with outreach to transitioning out of the program. Trust, by seeking to engage consumers during the housing intake and assessment process. Assistance with the application for benefits, both state and federal assistance. Engages and supports consumers through the lengthy interviewing and application process. Peer support and SOAR. Peer support specialists provide a critical service to community housing by using their experience to connect with consumers. From a program management standpoint, peer services, especially that of assisting consumers with applying for benefits, is a Medicaid billable activity. If a consumer currently does not have Medicaid, it becomes imperative that clinical and peer staff assist consumers with the application and record gathering process. Staff assigned to community housing have been instrumental with getting clients approved through the state and federal disability application process. SOAR trained staff is essential to this process. Ms. Joanne McCann on my staff has used her SOAR knowledge and training to make successful claims for the clients she has been assigned to provide assistance. And with that, you have my contact information. I will be more than happy to assist any of our callers with questions and answers or anything like that. And so with the appeals process, I will be more than happy to lend any assistance possible. Thank you for the invitation. And I'd like to move on to Joanne.
Thank you, Bill, and thank you for letting me be part of this webinar.
Yeah.
I am Joanne McCann, a certified peer support specialist, a certified recovery coach, and I am SOAR trained. Diagnosed with schizoaffective and severe bipolar depression. When about 20 years old, Mike and I were living in an abusive relationship. Started going to therapy. We left and I got divorced. Then I got a problem with my house. I hired a contractor. He took my mold and water pipes out, my money, and ran. So the house for 2 years with no water. Later, when I went to college and working as a student worker, I hired a lawyer to assist me for Social Security. I had sleep apnea so bad at this point that I could not sit down without falling asleep. went to court, the vocational expert said, "She can any job." I said, "All right, now I'll get it, but get it." And I applied for SSI myself, a closed portion for 1 year, because I had tried for that year to get a job with rehabilitation services, and I couldn't get one. My therapist referred me to PSR, psychosocial rehabilitation. It's the clubhouse. To reconnect to the community and show my job skills. That's when I met Bill Dowd, who is my boss. My manager at PSR, Teresa Canterbury, suggested I go to Genesee Health System and apply to be a case manager assistant. I took the first training to become a certified peer support specialist. Genesee Health System for 11 years at the house, CT, and in case management. That's where I got my SOAR training, and in housing where I can use it. I use people with any life skills support with learning, with getting out of the house more, and needed resources, obtain things at low or no cost, and getting a job or applying for benefits. While in other departments, I assisted several clients with getting benefits. I helped them get state assistance and stamps. I assisted a client in housing get her SSI approved using SOAR methods. Bill told me about 4 people that he wanted me to work with for SSI. I later went to him and said that I was getting overwhelmed because I had so many cases to work on. How can we make it so you aren't overwhelmed? I have to work on one case at a time or get confused. And I was wondering if you do the interviewing because that is my strong point, and you medical summary because that's what you're good at. He says, I read all of the records to get an idea of what extra questions to ask. It's easy getting all of this information out of people due to a lot of it being associated with trauma. Bill talk about the case and discuss what questionnaire to work on first and what follow-up is needed to get the medical summary. He sometimes doesn't have to go to court due to the judge reading it. That's how good the summary is. And sometimes I find out things that are important that Bill didn't know, like the person had heart trouble. Asking clients to apply for Social Security, they involved by helping with housing and benefits, courses and learning life skills. I share similar experiences, take my time and answer their questions. I treat them like who they are, my peer. Thank you. And contact information, I'll be willing to answer any questions that anybody has. Thank you.
Thank you, Ann, for your very informative and inspiring presentation. I think everyone is going to really appreciate the relationship or partnership that you have with Bill, your supervisor, to work out some of those challenges so that you can do this job well. So we do have some time to open the floor for questions or comments. And just to remind you, there are 2 ways that you can present questions to the presenters. The first way is to type your question into the Q&A panel located underneath the participant tab. That's one way. And then also to ask a question by phone, you can raise your hand by clicking the hand icon in the participant pod. We will unmute you so that you can ask your question. We have a question here from the phone by Lillian Zaworski. So we'll unmute you so that you can ask your question.
I have a question that was from the first part of the presentation because I couldn't hear you.
Okay, thank you.
Sorry.
Lily.
Jenkins, what funding resources were used to create the Peer Wellness Center?
Okay, it is for Brian. The question is about funding, how you funded the
Peer Wellness Center.
The Wellness Center. I believe Brian in Vermont. On the conference? I can see that you are talking. If you can, your line, I think, unmute using the microphone icon next to your name. Or your phone, on your phone directly. Well, we will take that question offline and get the answer out to everyone. We apologize for that. You see, we have another individual.
No.
And from Jonathan Marley, how do you become SOAR certified?
Okay. Pass that question on to Bill Dowd. Bill, the question is how Bill or really speakers, how to become, certified, become a certified peer support specialist, process involved in that.
I'm sure that we could answer this also. Each state has its own criteria. I mean, it falls within the Medicaid manual. SAMHSA sets a pretty big guideline about providing peer support specialists, peer support services. You have to call the state. It could be the Department of Community Health. In our case, it's now the Department of Health and Human Services here in Michigan, and find out what the criteria are and also establish when they have the classes. It's a 40-hour curriculum, week training.
Thanks. Brian, what is the process in Vermont if you are able to hear you this time? Unfortunately, we're having trouble with Brian's audio. We did have a question also about becoming SOAR certified. One way you can receive a SOAR certification, get some SOAR training, is through the SOAR online course, which is available on the SOAR website. So after you complete that SOAR online course, you receive a SOAR certificate and then make contact with your local SOAR program in your state. So please check that out if you're interested in a training, or you can go to your state page on the website to see trainings in your area, or get in touch with your SOAR state lead or one of your local leads in your state. So there are several ways to get SOAR training. We have another question that just came in from a Cantrell Jones. I work for a hospital and just learned of the SOAR program. I listen to everyone's presentation and congratulate every one of you. I joined the SOAR website and look forward to becoming a SOAR certified worker. This is more of a comment So thank you again, Cantrell, for those great words, and best of luck with the SOAR Online course. I think you'll find it very rewarding and give you some practical experience as well. For a few more questions.
It's a question. We're having trouble, Ed Jan was having trouble asking a question to Matt about the Bridger program, the Bridger programs. I referred to that in one of his slides, and we wanted some more information about that if possible.
Yeah, more information. That's a program that's run by the New York Psychiatric Rehabilitation Services, New York, Harvey Rosenthal. They've been in that program since 1994. It currently was created to help bridge individuals from the New York State hospital system back in the community. The program still exists now with great outcomes, and I could follow up and provide you more information about that.
Thank
Remind you that the presentation will be available on our SOAR website in a week. Also access it currently if you go up to the left-hand corner of the screen and click File to save, and then click Document. And you'll be able to get a copy of the PowerPoint presentation today. We do have several questions on that, so that's how you do that. I have a question.
Is the site that has state-by-state lists of peer programs?
Some information about where to access that. That's out there. One is the National Coalition for Mental Health Recovery, which has a list of a lot of the consumer-run statewide organizations.
To add that to the website when we post the PowerPoint and the audio version of this presentation. We'll add that resource as well. Looks like we have another question.
This question is for Joshua Black. Do you know of any SOAR services in King County, Washington, Seattle?
Hear me?
Yep.
I don't know any offhand, just because we're contracted to serve 13 Mason counties only, and King County is, well, we have county between ourselves and King County, so we don't do a lot of direct collaboration or warm handoffs with anybody in King County. If interested, feel free to email me, and I could certainly look that up and provide information. I just don't have it off the top of my head right now.
If you email us at the SOAR TA Center, you can email me specifically, Pam Hine. We can put you in contact with the SOAR leadership in that area, because there are SOAR programs. Sure.
So somebody asked me a question quite a while back in the Q&A section, and I have an option to send a response. It was from a Ronald LaFlash, so if they're available to ask the question, I'm having technical difficulties on this end, but I'm more than happy to try to answer the question in person.
Okay, sure, to get his contact information. I think that to have that available to you. Well, we have a question saved on this, so we'll be sure to reach him.
So much. I didn't want him to think I was ignoring him, because it's a great question.
Right, and he did put a question in our chat function, so we'll be sure to get that over to you too. We don't see it. Well, minutes left. If any one of our presenters would like to just share a comment on you know, some of the best ways to possibly reach, you know, to reach out to you, to get more information about your experiences. So with that, we do want to thank, you know, again, all of our presenters for sharing not only your experiences, but also reminding us of why we do the work that we do. And so just a quick reminder, please complete the brief online evaluation of today's webinar. You'll be sent directly over to the evaluation when you click out of the webinar. So again, more information on this topic, please visit the SOAR website at www.soar.prainc.com, and to contact the SOAR TA Center by email at soar@prainc.com or by phone at area code 518-497-715. We will be sure to direct any questions or comments which could not be answered today to our presenters for their responses. Thank you, and have a great rest of the day.